Welcome back to your Pediatric Dentist channel Tiny Thick Talks. If you are new to this channel, subscribe the channel, and for details of this channel visit the bio section, or you can also check out my first video. Sorry if there is any mistakes in videos or shorts. Today we will cover CT, spiral CT and CBCT. Computed tomography. Computed tomography, also known as a CT or computed Excel tomography, is an imaging modality that uses X-rays to create cross-sectional images of the body. Principles. The fundamental principle behind CT is the measurement of the attenuation of X-ray beams as they passes through the body. Attenuation means the reduction in the intensity of X-ray beam as it traverses the matter by either the absorption or deflection of photons from the beam. These measurements are used to reconstruct images of the internal structure of the body. So basically a CT scanner has an X-ray tube that emits a beam of X-rays and a detector on the opposite side. The X-ray tube rotates around the patient and detector measures its intensity of the X-rays after they pass through the bodies. As the X-ray tube rotates, it captures multiple projections from the different angle. These projections are recorded by detector and sent to a computer, and the computer processes the data using mathematical algorithms to reconstruct cross-sectional images of the body, and these images can be stacked to create a 3D representation of the scanned area. Coming to the advantages, high resolution imaging. High resolution images of dental structures allowing for the precise diagnosis and treatment planning. 3D visualization. Unlike traditional X-ray, CT scan offer 3D dimensional images which are crucial for assessing complex dental conditions and planning surgeries. Accurate implant placement. For dental implant planning, ensuring accurate placement and reducing the risk of complications. Detection of pathologies. Detect various pathologies such as the tumor, cyst and bone abnormality that might not be visible on conventional X-rays. Orthodontic planning help in evaluating tooth position, bone structure and other factors critical for orthodontic treatment plan. Coming to the disadvantages, radiation exposure. CT scans involve higher radiation doses compared to the conventional X-rays, which can be concern especially for children. Cost. CT scans are generally more expensive than traditional imaging methods, which can be barrier for some patients. Limited availability. Not all dental clinics have access to CT scanning equipment, which can limit its use in certain areas. Patient movement. Movement during the scans can reduce the quality of the images, which is more common in pediatric patients. Overuse concerns. There is a risk of overusing CT scans when they are not necessary, leading to unnecessary radiation exposure. CT technology has revolutionized dental imaging, particularly with the advent of the cone beam computed tomography. So we will see applications in dentistry in CBC. Coming to the spiral CT. Spiral CT, also known as a helical CT, is an advanced imaging technique that continuously rotates the X-ray source and detectors around the patient while the patient moves through the scanner. This continuous motion allows for faster data acquisition and the creation of detailed three-dimensional images. This is the continuous movement. So coming to the principles and mechanism of action, the X-ray tube and detector rotate continuously around the patients. The patient's table moves through the scanner at a constant speed, creating a helical path of a X-ray exposure. X-ray passes through the patient's body and are captured by the detectors, which convert them into electronic signal, and a computer processes this signal using the complex algorithm to reconstruct detailed cross-sectional images of the body, and these images can be stacked to create a 3D representation. Coming to the advantages, speed. Faster scans reduce the time the patient needs to remain still, improving comfort and reducing motion artifacts. High resolution. Provide high resolution images for better diagnosis. 3D imaging. Ability to reconstruct 3D images for more comprehensive analysis. Reduce artifacts. Continuous data acquisition minimize the likelihood of the motion artifacts. Wide range of applications. Useful in various medical fields including complex dental assessment. Coming to the disadvantages. Radiation exposure. Higher dose of radiation compared to traditional X-rays, which is a concern especially for pediatric patients. Cost. More expensive than conventional imaging technique. Not always necessary. Some cases may not require the high level of detail provided by the spiral CT, making it an overuse risk. Availability. May not be available in all healthcare facilities due to the cost and need for the specialized equipments. Applications in pediatric dentistry. Trauma assessment, evaluation, dental and maxillofacial injuries, developmental anomalies, detailed imaging of developmental issues like cleft palates, orthodontic planning, detailed visualization of tooth positions and bone structures, infection detection, identifying infections or conditions that are not visible on standard standard X-rays. Other than pediatric dentistry, it is used in implant planning, endodontic assessment, orthodontic treatment, and trauma assessment. Coming to the cone beam computed tomography. Cone beam computed tomography (CBCT) is a specialized type of X-ray equipment used when regular dental or facial X-rays are not sufficient. This technology provides 3D images of dental structure, soft tissue, nerve path, and bone in a single scan. It is widely used in dentistry for its ability to provide detailed images with a lower radiation dose compared to traditional CT scan. Coming to the principles, CBCT operates on the same basic principle as a conventional CT but uses a cone-shaped beam. This is a cone-shaped beam which captures the data in a single rotation around the patient, creating a comprehensive 3D images. So basically, the X-ray source rotates around the patient's head, emitting cone-shaped beam of X-rays, and the detector captures the X-ray that passes through the patient head, converting into the digital signals, and a computer processes the signal to reconstruct a 3D image of the scanned area. Coming to the advantages, high resolution provides detailed image of the bone and soft tissue structures. Use a lower dose of radiation compared to the conventional CT scans. 3D imaging offer 3D images that are crucial for accurate diagnosis and treatment planning. Quick scan time. Faster scan time reduce the patient discomfort and motion artifacts. Coming to the disadvantages, radiation exposure. Although lower the conventional CT, still involves the radiation exposure. Cost. Higher cost compared to the traditional 2D radiograph. Limited availability. Not available in all dental practices due to the cost and the need for the specialized equipment. Lack of appropriate bone density determination. Applications. Dentistry. Used for the dental implant planning, evaluation of impacted teeth, assessment of jaw, bone structure, and diagnosis of dental caries and infection. Orthodontics. Assist in treatment planning by providing detailed images of the teeth and jaw alignment. Endodontics. Help in diagnosis root canal morphology and detecting root fractures. Pediatric dentistry. Used for assessing dental and facial trauma, evaluating developmental anomalies, and planning orthodontic treatments. So basically, the difference between CT, spiral CT, and CBCT is that in traditional CT, use the X-ray beams to create cross-sectional images of the body, and the X-ray tube rotates around the patient in a step and shoot manner, capturing slices of the area being imaged. In spiral CT, it continuously rotates the X-ray tube and detectors around the patient while the patients move through the scanner, creates the spiral or helical path leading to faster and more comprehensive imaging. And in CBCT, use a cone-shaped X-ray beam to produce 3D image in a single rotation. These are some of the references. Stay tuned for the next part. If you want this PDF or any other PDF, just like, subscribe, and comment your mail ID with the topic, and I'll send you the PDF. New videos on Thursday evening 6 p.m. and Sunday morning 11 a.m. Also, we try to put MCQs according to topics in our shorts with the answers and explanation if needed, which will help you in Viva or NEET exams. Like, share, and subscribe the channel. Thank you.